My name is Sneha and Sneha Hari. I am a speech language pathologist. I graduated from Mangalore, MV Shetty College of Speech and Hearing. Post that, I did my internship for a few months in Narayana Hospital, and then from there I developed an interest in adult neuro rehab. But I was not able to find a good center where it provides me that kind of exposure. So I kept looking, and then I found this place. I applied and then came for the interview, got selected, and then I joined here. After that, it's been a great, very big, wholesome experience in neuro. And one thing, starting with the exposure, the number of cases, the different types of cases, the brain case, spine case, I came to know about what a speech therapist can do even in a spine case. It's something that's not normally done everywhere. The instrumental evaluations that we do, there's something called as a barium swallow assessment. So that is not easily available anywhere else. So we are exposed to that also here. And the wide variety of patients, starting from ICU, where we see very, very acute cases and we give our inputs, everything, even in the ICU setup, till a chronic patient, like in a resort facility also that we have, long-term patients, 2 years they've been here. So such patients also, the exposure is very high. And apart from the clinical perspective, we have other roles also here, even a little bit of clinops, the clinical operations perspective, even in the, so basically here they'll find out what is your skill and then help you grow in all different things other than even the clinical. So along with clinical, you can grow in other areas also, depending on your interest and skills. Acute setup, you have these tracheostomized patients, those who are not able to breathe for themselves, and such patients we'll do a tracheostomy. So for the removal of tracheostomy, there's a big role by the speech pathologists here. We start with their tolerance. So there's something called as a deflation, blocking. There are different steps as to how we take out the tracheostomy. So we do that, timed deflation trials, timed blocking trials, so that we can remove the tracheostomy out faster, and also, but it has to be safe. We don't make a hurry and remove it just because we have to get it out. We don't do that. So we make sure that it is safe for the patient, and then we do it. That is one perspective. Then another thing is, post stroke, there are people who've got speech clarity issues. It's called dysarthria. So in such patients also we give different oromotor. You might see, like if you see the patient, there's a weakness on one side of the face, there's a drooping of the lips, weakness of the tongue. So such things also we work on. Then language perspective. So post stroke, post head injury, you see a lot of patients with language issues. They don't understand what you're saying, they're not able to follow commands, they're not able to give you eye contact, they're not able to name things, they're not able to repeat. So some people may not be this severe, but some people, so different kinds of aphasias are there, where there are conditions where they don't understand what you're saying, but they'll just keep speaking random irrelevant speech. So there also we work on them. There is also when they understand everything, but they're not able to speak. So such conditions also we help them to speak. Some people, everything will be normal, but they just won't be able to name things. So those patients also we work on. There's something called as apraxia. Not a lot of cases happen. It's something less common than aphasia and dysarthria, but those cases also we work on, where they know what they have to say, but they're not able to say it properly. Then also in dysphagia, that's the swallowing part of it. So some people have difficulty in their oral phase, they're not able to chew properly, they're not able to sip water, they're not able to control the food in the mouth. So those patients also we work on. And also some people have in the pharynx level. So when they swallow, they aspirate the food, it goes into the lungs. So those people also we work on improving their swallowing. We'll do both. So if they have an oral problem, we'll do exercises and training for that. And if they have a pharyngeal problem, we do their swallow strengthening that way also. So these things we do.
So can you tell me about your journey here
in PRS? So when I joined as a basic speech language pathologist. Last year, August 17th, I have joined here. And the first, maybe the 6 months was complete you know, something you would expect when you do your course. I got exactly that what I wanted. So this was like my dream job. So hospital exposure, acute cases, lots of learnings, lots and lots of learnings happening. Every day you learn so many new things, you know, and interacting with neurosurgeon, neuropsychologist, doctors, such close interaction with the medical team. and you know that we have a transdisciplinary approach here, so there are physiotherapists, occupational therapists, everybody works together, and that was a very different kind of experience. You know, even though I haven't worked before, in my internship centers that I have gone to, I have not seen such kind of a teamwork as such. You know, even though they have the physiotherapy department, occupational therapy department, it's not a team work, it's each person does what they have to do. But I think that teamwork has made a big difference in the recovery of patients here. And then from there, the first 6 to 7 months was more of clinical work, and then seeing patients. Basically, the first few months is on only gaining experience, seeing patients. We started doing barium swallow studies, and that also gave me a different perspective on swallowing evaluations. And then after that, I, you know, started taking up some of the cognitive. Dr. Pratibha trained me for cognitive evaluations and the neuropsych battery, so I started doing that also. That came in along with my speech. Then after that, I was promoted to team lead position, where, you know, we have a team where there is maybe 4 members, physiotherapist, occupational therapist, and a speech therapist. Together we form a team. And then, so then I was promoted to being the team lead there. And then for some time I was doing that, and then recently I got promoted to unit head position. So I'll be starting next week probably in Jain Hospital. So ClinOps perspective, that happened. And currently I'm the department in charge for speech language pathology. So again, in the clinical perspective, that was another growth that I had.